Hello, dear colleagues. I'm honored to be a contributor for the bulletin. And today will be a rather different point of view to sleep medicine, as I'm going to present an interesting aspect for history of sleep medicine. It's actually my investigation into Armenian national epic poem, where we found possibly the first description of Kleine-Levin syndrome. The epic poem is called The Daredevils of Sassoon, and I will go forward. Now, you can find in medical literature some interesting depictions of different sleep disorders taken from various literature works, like Charles Dickens' renowned description of obstructive sleep apnea in his The Pickwick Papers novel, or dream enactment behaviors noted in Franz Kafka's America, or sleep paralysis found in The Brothers Karamazov by Dostoevsky. The Armenian national epic poem, The Daredevils of Sassoon. It's an interesting cultural aspect, very important actually. It's an oral tradition which is noted by UNESCO's representative list of the intangible cultural heritage in 2012. This is a famous painting by Hakop Kojoyan, Armenian artist, who depicted here the main fragments from the David of Sassoon part of this famous epic poem. And it describes the story of David and Masra Melik. So the most famous positive hero of this folktale is David of Sassoon, and Masra Melik is the evil king of Masur, which was actually Egypt at that time. So Masra Melik was the villain character of this poem. And they have a battle planned, and David is coming for Masra Melik's site. But it turns out to be that Masra Melik is sleeping, and his guard says he must sleep for 7 days, and as 3 days are over, he will sleep 4 more days before he wakes up. So his people who surrounded him actually knew that he sleeps for 7 straight days, which is very interesting and unique finding, I think. And it's interesting that this finding is stable throughout the different versions. There are many versions of this poem coming from different parts of historical Armenia, but this is a very stable number, 7 days. The poem was also translated and adapted into English, and here you can see some verses coming from Shalyan's version, published in 1964. This part when David came to Masra Melik's site, and he asked the guard to wake him up, and they tried to use heated iron rods and put them against Melik's feet. And then he murmurs and says that there are fleas in my bed, they are biting me, and they tried heated plowshare. And again, he was complaining of many fleas in his bed that are biting him and do not let him sleep. So it's interesting that this part was also depicted by Hakop Kojoyan in his David of Sassoon painting coming from 1922. And here you can see the guards or his soldiers trying heated rods to his legs probably, and he's barely woken up. This is an interesting part to be described because actually it's not only the sleepiness that is described, it is also the lack of appropriate perception of stimuli coming from outer world. He was finally pierced by David's spear and was finally woken up for a fight. So this is the short description of this episode. And we go into the description of the case because actually in epic poems, usually sleep is more like rather either a lazy part, like expressing hero's laziness, or maybe regaining his strength. So 7 days and 7 nights he will sleep and regain his strength. Of course, this is the most probably appropriate explanation, but still 7 day straight sleep is rather a strange but at the same time a stable finding in this epic poem, and coming together with other signs expressed in these verses, we can see that misperception of sensory input is also obvious in this case. And no sleep complaints were found in other parts of this epic poem, which could be also supporting our hypothesis. Unfortunately, no other information on possible additional pathological behaviors, which could be features of central hypersomnias like Kleine-Levin syndrome is, like anorexia or hyperphagia or hypersexual behavior or other cognitive dysfunction, were not found in the text. Still, the deep and arousable 7-day sleep of Masrameli could be an important medical historical finding, as this epic poem is coming from 8th to 9th centuries of current era, and the description of his sleep most is resembling a hypersomnia of central origin of Kleine-Levin syndrome type. It's important to note that there is another similar description of hypersomnolence found in the story of Kumbhakarna from Ramayana, although the authors of the paper describing and discussing this case, they are more prone to describe it as a wider hypothalamic pathology. So we have described the case of Masrameli as the possible first description of Kleine-Levin syndrome, coming from the Armenian national epic poem, The Daredevils of Sassoon. Shortly about Kleine-Levin syndrome, it's otherwise called recurrent hypersomnia or periodic hypersomnia, and it's characterized by relapsing remitting episodes of severe hypersomnolence associated with some cognitive, psychiatric, and behavioral disturbances. So these are the diagnostic criteria for this syndrome taken from the latest edition of International Classification of Sleep Disorders. As you can see in the point D, it's important that the patient must demonstrate at least one of the following during the sleepy episodes. These are cognitive dysfunction, altered perception, eating disorders, either anorexia or hyperphagia, and also disinhibited behavior such as hypersexuality. We think that the story with the fleas could easily fit with the second criterion of this point, altered perception. Epidemiology of KLS, it's quite a rare disease, known to be 1 to 2 cases per million. And usually the age of onset is early adolescence, although we can find a lot of atypical cases, atypical for age, for representations, and other features of the syndrome. So we can go forward. This is slide, quite a fresh paper coming from American Academy of Sleep Medicine. Their recent guideline on the treatment of central disorders of hypersomnolence, and here we can find a small part dedicated also to Kleine-Levin syndrome. So the only more or less clarified role for the treatment in KLS is spared for lithium and no other drug. There are many drugs being tried for KLS, are still in debates of usefulness and efficacy in KLS. In conclusion, we can say that the Daredevils of Sassoon is an important medieval Armenian epic that reached our days through an oral tradition recognized also by UNESCO. Masrameli in this epic poem is the villain character in one of the storylines, and his clinical features of his 7-day-long sleep could resemble a Kleine-Levin syndrome added by altered perception and impaired arousability. Malik's sleep pattern is not fully uncovered. However, main signs, as we found, correspond to the ICSD-3 criteria of Kleine-Levin syndrome. And the significance of this finding is that this could be the first historical description of Kleine-Levin syndrome, considering the age of the epic poem starting to form back in 8th to 9th centuries of current era. Thank you very much for your attention. I hope this cultural representation of a historical aspect of sleep medicine was interesting for you.